Good morning. My name is Christopher Garcia, and I'm from Littleton, Colorado. I'm 47 years old and work as a ramp agent at the airport, loading and unloading luggage and cargo and helping guide and park our aircraft. I am also a husband and a father of 4, and if that's not enough to worry about, I was born with 4 bleeding disorders, several allergies, and chronic asthma. These medical conditions leave me in a constant state of uncertainty and can spiral into both a health and financial crisis at any time. The treatments I need just to stay alive cost $800 a month, even after my insurance coverage. I work 4 extra shifts a month to help offset the costs, and even then, that's often not enough. I'm constantly forced to split my medications or decide which medications to forego altogether because I simply can't afford them. Every morning, I hope I have enough meds just to make it through the day without a medical issue. And I know millions of Americans grapple with similar decisions when it's time to refill our inhaler prescriptions at the pharmacy counter. For too long, inhaler manufacturers have prioritized profits over patients, leaving people struggling to afford the very medications that they need to survive. I never imagined things could change, but President Biden has shown us all that they can. The things he's done to cut healthcare costs are literally saving the lives of so many Americans, myself included. I can't describe how grateful I am and what it means for me and my family to know that we have a president who thinks every day about how to improve the quality of life for people like me. To know that we have a president who cares about giving me a chance to spend less time worrying about surviving and more time with my kids as they grow. And now it is my greatest honor to introduce the President of the United States, Joe Biden.
Chris, thank you. First of all, thank you for the courage you've shown over the years dealing with your health issues, but also for standing up here before the whole nation and explaining to us what you've gone through. It's not easy to do. You know, trying to afford your expensive medications from blood disorders to asthma. Millions of Americans, millions, have similar stories, lying in bed at night, literally staring to the ceiling, wondering what in God's name will happen if their spouse gets cancer, or if their child gets sick, or something happens to them. Are they going to have enough insurance? Can they afford the medical bills they're going to have? Will they have to sell the house to keep things moving? You know, and you find out the big reason why we're lying awake at night with these questions is because the drug companies are charging exorbitant prescription drug prices. Higher prices than anywhere in the world. And Bernie said it, I was listening in the back, Bernie. You and I have been fighting this for 25 years. Finally we beat Big Pharma, finally. I'm serious. I'm proud. I'm proud of my administration has taken on Big Pharma in the most significant ways ever. And I wouldn't have done without Bernie, and Bernie got it, you know, look, Bernie was the one who was leading the way for decades in which why we're here today. You know, Bernie mentioned Americans pay more for prescription drugs than any other advanced nation in the world. If you walk into a local drugstore here in America, the prices are at least 2 to 3 times more for the exact same prescription made by the exact same pharmaceutical company in Canada, France, Italy, and even in Eastern Europe, all around the world. But not anymore. For years, people have talked about how Medicare has the power to negotiate for lower drug prices, prescription drug prices, the government pays for, just like the VA does when they're able to negotiate medicines and needs for the veterans. But we've tried and tried and tried. And finally, with Bernie's help, I finally got my Inflation Reduction Act, which passed. Bernie helped get it passed. Not one Republican in the entire Congress, this did surprise me, I have to admit to you, not one single Republican voted for it, not one single one, to give us authority to take on and beat Big Pharma. Take insulin for people with diabetes. It costs $10 to make. If you add everything in terms of packaging and all the rest, you can argue maybe $12 total. And they're charged as much as $400 a month. Not anymore. Not anymore. Seniors with diabetes will only have to pay $35 a month from this point on. And by the way, when I first got the law passed, guess what? It applied to every American, every American. But the Republicans were able to cut back on the fact that they only were not able, the only thing they couldn't defeat was seniors. But I want those savings to be for every single person in America, no matter what their age. No one should pay more than $35 a month for insulin, period. And by the way, drug companies still make a significant significant profit. Because I said $10 to make. By the way, the guy who invented the drug didn't want to patent it because he wanted it to be available to everybody. Well, it's available, all right. Look, folks, there's a whole lot of prescription drugs that are undergoing the process of lower pricing. Medicare is now able to negotiate lower prices for some of the costliest drugs that treat everything from heart disease to arthritis. This year alone, the law that's already passed, it's in the law now, that we signed, Medicare is negotiating 10 of the most costly drugs next year, and they'll do that every year, it goes well beyond 50 drugs. Next year will be 15. It isn't just saving seniors money. Along with other reforms, it's taxpayer money. We're cutting the federal deficit. And people say, well, it's costing money. Guess what? It's costing drug companies money. It cuts the deficit by $160 billion. $160 billion. I'm serious. Think about it. The next 10 years, because Medicare will no longer have to pay those exorbitant prices. Instead of paying $400, they're paying $35. But I think we should be more aggressive. It's time to negotiate lower prices for at least 50 drugs a year. We only have the law only requires 10 now, and then 15 and moves up. Along with other actions, we're not only saving lives, but if we move that number up, we'll save taxpayers another $200 billion on top of the $160 billion because Medicare will not be paying these exorbitant costs. It is a gigantic, and by the way, the other guy talks about cutting the deficit. He increased the deficit more than any president has in history. And we've cut it. Look, in addition to the law we passed, will cap prescription drug costs for seniors and Medicare starting in 2025. It's already the law. It doesn't require anything else because when I say these things, you think you can get it done. It's already the law. Your drugs will not cost you, if you're a senior on Medicare, will not have to pay more than $2,000 a year no matter what the drug costs. And as you know, many of you unfortunately know, with your parents, some of the cancer drugs cost $10,000, $12,000, $15,000 a year. Combined, they'll not have to pay a penny beyond $2,000 a year. And the drug companies will still make a lot of money. Folks, Bernie and I want to cap prescription drug costs of $2,000 a year for every American, not just seniors. We're here today to talk about how we're lowering prices and cracking down on unfair competition in prescription drugs. I'm a capitalist. Capitalism, though, without competition isn't capitalism, it's exploitation. That's what's going on, exploitation. When Big Pharma doesn't play by the rules, competitors can't offer lower prices for generic drugs and devices that carry that medication, so prices are raised artificially. I thank Bernie for leading the charge to do something about this. For example, asthma is one of the most common respiratory illnesses in America. 27 million Americans have asthma, including 4 million children. Asthma causes about 1 million visits to hospital emergency rooms every year. Nationwide, the cost of treating asthma is estimated to be $50 billion a year, the treating asthma, not the drug, treating the asthma. If you have asthma, you're likely to need an inhaler to breathe. Now, this spring is here. The seasons and allergies are upon us. We're on the rise even more. More people with asthma need inhalers to breathe. You know, many asthma medications may have been on the market for more than 25 years. They cost less than $5 to make. It costs less than $5 to make. But the medication hadn't changed at all. Theoretically, if the drug company came with a new medicine that they invested a lot of money to find a better way, they wouldn't have to, they could argue another price. But drug companies have increased prices for asthma drugs up to 8 times more than the original cost. And the mechanism the mechanisms attached to the inhaler, the thing that makes it, go into your nose or mouth, that is a device that Medicare hasn't changed much either. Look, these big companies try to keep generic companies away from getting patents on devices that deliver the medicine through the inhalers. So there's 2 pieces. It's not just what's in the inhaler, it's the mechanism that allows it to go into your body. For example, they slightly changed the cap of inhaler, and they used the new patent on that cap to block generic drug companies from being able to enter the market. It's a big deal. Playing these games with patients and pricing, Big Pharma is able to charge Americans significantly higher prices and pad their profits. Senator Sanders has pointed out one company sells an inhaler for $49 in the United Kingdom. You know how much it's charged in the United States for that one inhaler? $645. So I take you, $645. If you need that inhaler, you get an Air Force One, but the next time I go to London, you can get off and you can get it for... I'm serious. Think about that, though. Just think about that. For the same exact medicine and the same exact device. It's outrageous. Another company sells an inhaler for $9 in Germany. $9 in Germany. And we pay $286 here in the United States. $9 in Germany, same outfit, same company, same device. And so 30 times more. 30 times more, I repeat, it's outrageous. We're doing something about it finally. Why in God's name should an American pay $645 for the same inhaler sold in the United Kingdom for $49? By the same outfit, the same outfit. Bernie called out the drug companies during the congressional hearings. And you just heard from Lena Khan, the chair of the Federal Trade Commission, who's working with the Food and Drug Administration to crack down on these drug companies. And it's a big deal. As a result of all this action, some drug companies have withdrawn their abusive patent listings for inhalers and other common products like EpiPens. The last few weeks, some of the big drug companies have gotten the message to reduce the prices for some asthma drugs. Bernie's a big reason why that's happened. In fact, 3 of the 4 largest companies are capping the cost of inhalers for many patients. That can be up to $600 out of pocket at $35. There's some progress going on beyond what we've done in the law. But it's about time. And going forward with more competition and more generic drugs in the market, the price could even be less than it is now, coming down. But that's not all. Because of all of you, my Inflation Reduction Act, drug companies that raise prices more than inflation are going to pay back Medicare the difference between what they charge and the inflation rate. This is based on the price of their drugs in 2021. That means consumers will pay less for prescription drugs, and they'll save taxpayers money and discourage companies from hiking prices faster than inflation in the first place. But we want to do more. It's time that drug companies pay rebates when they increase prices faster than inflation, not just for seniors, but for every single American. Every single American. And today's announcement follows action we've already taken to significantly reduce the health care cost for average Americans. We took action to reduce the cost of hearing aids for millions of Americans by as much as $3,000 for a pair of hearing aids. In addition, my administration is banning junk fees on health insurance plans. These are the plans that stick consumers with big unexpected charges instead of covering the care they need. Look, they ended up with I ended up with surprise medical bills, so hospitals that are in-network can't send you a bill for an out-of-network doctor you didn't choose or you haven't even consulted. I was in hospital for a while years ago, and that happened. Kamala and I are protecting and expanding the Affordable Health Care Act, known as Obamacare, which I might add is still a big deal. Today, thank God my mother wasn't here. Today, 21 million Americans are covered through the Affordable Care Act, 9 million more than when I took office. exact tax credits. We enacted tax credits to save an average of $800 per person per year, reducing health care premiums for millions of working families who have coverage under the Affordable Care Act. These tax credits, though, expire. You can only get it through this year. And I'm calling on Congress to make tax credits permanent for this process. And folks, all of our progress is in stark contrast to my predecessor and mega Republicans in Congress. They want to, quote, I love their word they love, they want to terminate the Affordable Care Act. I love it, terminate. As my predecessor says, kicking millions of Americans off their health insurance. And by the way, the vast majority of these people would not be able to get insurance because they have a pre-existing condition. They also want to eliminate the Inflation Reduction Act, eliminate the savings to lower prescription drug prices, and so much more. During the last administration, my predecessor exploded the national debt more than any previous president in the history in a four-year term. More than any previous. He talks about the debt. He exploded it more than any other president in a four-year term. With his $2 trillion tax cut that overwhelmingly benefited the very wealthy and the biggest corporations in America. Now he and his Republicans in Congress want to cut Social Security, raise the age, and cut Medicare, while they cut taxes for the very wealthy again. You know, I got a better idea. I'm going to protect Social Security and Medicare along with Bernie and other members of Congress to make sure the wealthy begin to pay their fair share to keep these programs solvent. It's not hard. Let me repeat what I said that even some people like Bernie didn't like at the beginning. I don't blame him. But I said in day one, to make a point, no one in America will pay a single penny more in federal taxes if they make less than $400,000 a year. I wish I was able to do that. I was listed, and Bernie used to kid me about it, I was listed as the poorest man in Congress for 36 years. I didn't think I was poor. I got a good salary, but I was the poorest man in Congress. Trump brags about he's the reason Roe v. Wade was overturned. Here's his quote, I did something no one thought possible. I got rid of Roe v. Wade, end of quote. And now he and his MAGA officials are calling on for a national ban on the right to choose in every state. I promise you, with the Democratic Congress, Kamala and I will make Roe v. Wade the law of the land again. I promise you. I'm talking too long here. Let me close with this. I'm excited about this. I'm really proud of what we've been able to do. I really am. Bernie and I have been doing this work for a long time. I know we don't look it, but we've been doing it a long time. Bernie and I have something else in common. We both married way above our stations. But at any rate, what we know, we've made historic progress in the last 3 years. $35 for insulin for seniors, $35 a month for inhalers, for asthma, $2,000 a year total cap on costs for seniors. We're lowering the cost of some of the most expensive prescription drugs for seniors. And what I want to do next, what we want to do next is these caps and costs for everyone, not just seniors. With Bernie's help, we're showing how health care ought to be a right, not a privilege in America. And that's why I've never been more optimistic about it. I really mean it. You've heard me say in this very room how optimistic. I am optimistic because the laws we got passed are now coming into effect, whether it's infrastructure or whether it's this. I mean, there's so much more. We have to, and I've said this many times, and I'll get out of your hair. You know, we have to remember who we are. We're the United States of America. I mean, this is from the bottom of my heart. We're united. There's nothing beyond our capacity when we do it together. We're the only nation, as a student of history, that I can find that's come out of every crisis we've entered stronger than we went in, every single time. So let's remember we're the United States of America. God bless you all. May God protect our troops.
Please welcome back to stage Senator Bernie Sanders.
Thank you all. I think the podium's yours.